your risks for colorectal cancer? Find out more on this episode of Inspire Iredell.
Welcome to Inspire Iredell. I'm Megan.
I'm Anna.
Today we are so happy to have Dr. Gangireddy with us from Piedmont HealthCare.
Thank you all.
He's a gastroenterologist and practices both at Piedmont and at Iredell Health System. He's a fellow at the American College of Physicians and loves traveling and photography. So welcome, Dr. Gangireddy. We're happy to have you here with us.
Thank you so much.
Yeah. So March is something a lot of people don't like to talk about. So Colorectal Cancer Awareness Month. So that's why we have you here. I know that it's something you're passionate about, being a gastroenterologist. So tell us a little bit about what inspired you to be a gastroenterologist.
So my interest in gastroenterology started as I was doing my residency training. Initially, I wanted to become an oncologist and a basic science researcher. But as I was going through the field and going through various rotations, it became very apparent to me that I love interacting with patients, and I also love to be hands-on. So gastroenterology gave me an opportunity to do both. Here we see patients in the clinic and manage them. If they need procedures, we do them in the endoscopy center. And some of the procedures that I do will prevent cancers as well. For me, it's like a best of oncology, medical, and all the worlds together. So, and then furthermore, the physicians that I work with, my mentors, were very passionate, were very happy in what they did. So it kind of created a positive environment for me to get into this field.
Oh, that's really cool.
That's awesome.
I always wondered why someone would want to, but I'm thinking it must be so interesting, the things that you get to see and what you get to do. That's really cool.
Well, it's such a, gastroenterology has such that preventative component to it, which we'll talk a little bit more about that when we talk about colonoscopies and things. But I'm sure that's very rewarding to be able to find something, before it becomes something detrimental. Yeah,
especially like preventing cancers is huge, especially how frequent it is and it's very good.
Wow. So we were saying colorectal cancer. What is it?
So cancer is abnormal growth of cells in the body and abnormal growth of tissue, and it causes tissue destruction. Colon and rectum is the last portion of your GI tract. It is also called as the large intestine. And abnormal growth of cells in the colon or rectum leads to colorectal cancer.
Okay. So large intestine. That's good. Because sometimes I think we hear colon and colon cancer and colorectal, but sometimes we don't realize what it is. Yeah. So your colon is your large intestine.
Yes.
It's good to know.
So why is an awareness month important?
Colorectal cancer awareness is very important because it's the fourth leading cause of cancer here in U.S. and the second leading cause of cancer death here in U.S. And our lifetime risk of having colorectal cancer is around 4%. To put it in a different perspective, our risk of having motor vehicle accident, death from a motor vehicle accident, is around 1%.
Wow.
So it is a significantly higher risk than death from a motor vehicle accident. And furthermore, it's colorectal cancers are very preventable. Around 85% of the colorectal cancers can be prevented with appropriate screening and surveillance techniques. And there is a recent estimate from 1975 till 2020, around 940,000 colon cancer deaths were prevented here in U.S. Mainly from screening. About 80% of them is from screening. About 20% of them is with advancements in management of cancer. So it's very preventable disease or cancer, so its awareness is, I think, is very important.
So 85% preventable.
Yes.
85%.
Yeah.
That's crazy.
More likely to die in
a car accident.
Wow.
Yeah. I think it's interesting because I've heard people talk about, colon cancer and how a lot of times you can catch it so early because with colonoscopies and treatments and things that are in place. But when you hear those statistics, it's like if you knew you had an 85% chance of preventing cancer, wouldn't you do it?
Yes.
Wouldn't you do it? This is not a 5% chance.
Yeah.
This is not, even 50% chance, but 85% chance to prevent it.
Yes.
Those are great odds.
Yes. That's very important.
Yeah, and for those of you watching, in Iredell and surrounding counties, I mean, this care is right here. So,
Right.
Get a
don't have to travel.
referral, go do it. You don't have to travel. And I'm sure that if you're not around this area, there's someone close to you that probably does screenings for this.
Absolutely.
So, what increases your risk of cancer?
So various things that increases the risk. The most important is age. As we grow old, the risk of colon cancer increases.
Okay.
Now it's recommended to start screening for colon cancer at the age of 45 for an average risk person.
Okay.
The other factors that increases the risk are tobacco smoking. Not only increases the lung cancer, but also increases the risk of colon cancer. Hence, tobacco smoking cessation helps with both the cancers along with other things. And alcohol use is also a known risk factor for colon cancer. Obesity is also a risk factor for colon cancer. So those are and some patients have inflammatory bowel disease, like ulcerative colitis, or having Crohn's disease, which involves the colon, that also increases the risk for colon cancer.
So you said 45 is the age to start.
Yes.
If you have family history,
Yes.
So what age do you start if you have family history? Because I'm assuming that's probably a pretty big risk factor
Yes,
as well.
it's a family history is a big risk factor, especially first degree family member having colon cancer is a significant risk factor.
So like mom, dad, sibling?
Yes, mom, dad, siblings, so they are considered as first degree. So when you have a first degree relative, say for example your mom having colon cancer, now it comes to at what age your mom was diagnosed. If she was diagnosed after the age of 60, then you need to have colonoscopy starting at the age of 40. And from there, if it is less than 60, at the age of 40 or 10 years earlier than your family member diagnosed. Say if it's 48, it's a 58, it starts at 40. But if your mother is diagnosed at 48, then you start screening at the age of 38.
Okay. Wow. So important to know your family history. Really, really important. So maybe a little bit of a not tricky question, but maybe a little bit more technical. Let's say your mom is 40 when she's diagnosed. So you need to start at 30.
Yes.
Now let's say that, and that would be for all the siblings, right?
Yeah.
But then let's say a sibling goes in at 30 and is and has something to be concerned of. So do the other siblings then go off of the siblings' age then? Okay.
Yes. It goes off the siblings, Any first degree relatives and having multiple family members also significantly increases the risk too.
Okay.
So it goes by if your sibling is now diagnosed with a colon cancer, then you go off of at what age was she diagnosed with.
Okay. And now does it have to be cancer, or can it just be, so I know they talk about in colonoscopies you find polyps.
Yes. So high risk polyps, polyps like greater than 1 centimeter in size, polyp which has adenomatous. There are certain changes that we look that increases the risk of colon cancer. So having the high risk polyps will also increase the risk for colorectal cancer.
So does that impact what age you should be screened at?
Yes, it's similar to high-risk polyps or colon cancers.
Okay.
The both are tied together. So
Okay.
The recommendations are the same for both.
Okay. So what is a polyp?
Polyp is a growth in the colon. Fortunately, colon cancer screening is so important that about 85% of the time you have these growths in the colon, which are tissues, which over the course of time turns into cancers. So that's the reason why doing colonoscopies or having appropriate screening, the whole goal for us is to identify those precancerous polyps before they turn into cancers and remove them so that we can prevent cancers. It takes around 10 years for those polyps to turn into cancers, and that's what the basically recommendation of a 10-year follow-up comes from is if you have a normal colonoscopy, it's recommended 10 years for a follow-up to identify any new that's happening in between.
Okay. And so if they don't find anything, then it would be it's 10 years in between colonoscopies.
For an average.
If they find something, is it 5 years, 3 years, just depends on what it is.
Yeah, it depends upon what it is. It depends
Okay.
upon how many polyps. It depends upon what kind of polyps are they. So basically, a gastroenterologist will look at all of these and give a final recommendation once we get the pathology report. That's when we finalize. Anywhere the high-risk polyps can we. Depending upon the number, 3, 5, 7 years, or some polyps, if it's only one, it's recommended to be do 10 years too.
Okay. Wow. Lots of information.
Yeah,
there.
it is. So, how would you know that are there symptoms of colorectal cancer?
Unfortunately, that's another important thing. Most of the colorectal cancers are diagnosed in asymptomatic patients. They come for their screening colonoscopies, surveillance colonoscopies. That's when we diagnose them. Some of the symptoms that you need to be worried about: having rectal bleeding, having unintentional weight loss, having change in bowel habits. Those are some of the factors that need to trigger further investigation, and a colonoscopy should be considered if not done recently. And also, as I said, it's diagnosed if it is a stage 1 or a stage 2 cancer, where the cancer is mainly limited to the lining of the colon, it presents asymptomatically. If it is stage 3 colon cancer, which involves regional lymph nodes, most of them present asymptomatically as well. Some of them have like weight loss, other symptoms. But if it's a stage 4 cancer where the cancer spreads to other organs like liver and lungs, they happen to have scans done for some other reason, and then they find like a mass or a tumor in the lung or a liver, and then they happen to sample it, and then that's how it is shown to be coming from the colon, and that's how some of them were diagnosed. So that's the reason why screening is so important, because until it becomes too late, we would not be able to know it. And that's the reason why the earlier, the screening done adequately will significantly prevent the colorectal cancer.
Wow.
So screenings are so important. Having a primary care doctor that also may notice some things and can refer to
Yes.
someone like Dr. Gangireddy is important.
Right.
Wow. So we're talking about screenings and colonoscopies. Is colonoscopy really like the gold standard, that's how you would diagnose, or are there other screenings available?
So fortunately for colon cancer, there are like 7, 8 different screening methods that are available. Okay, I cannot think of any other cancers having these many options to
neither.
screen. So the colonoscopy is the best way to check for colon cancer. It is around 95% sensitive in identifying colon cancers, and also 95% sensitive in identifying precancerous polyps. So if it's normal in an average person, it's recommended once every 10 years. Other options include flexible sigmoidoscopy. It's also a procedure similar to colonoscopy, but mainly looking at the last portion of the colon and rectum. It is also similarly sensitive in identifying colorectal cancers and polyps, similar to colonoscopy, but is only limited in identifying that last portion. And it is recommended every 5 years.
Okay.
And there is also a CT colonography, which can be done. It's a CT scan done to check for colon cancer.
I didn't know that.
Yeah. So it is also around 83% sensitive in identifying colon cancers, and around 83% sensitive in identifying polyps greater than 1 centimeter in size. So that is also a valid option. It's recommended every 5 years. And then now there are stool card tests that are very popular as well. Cologuard testing is very sensitive.
Yeah, I've heard about that.
Yeah. So it's very sensitive, and it is good in identifying colon cancer in about 92% of the cases. And it is little less sensitive in identifying those precancerous polyps, around 43%. And there are other stool tests like a fecal occult blood testing, fecal immunochemical test, or a FIT test. Those are done annually. Their sensitivity is around 70 to 73% in identifying colon cancers, around 24% in identifying precancerous polyps. And now there is a newer blood test that came into market. It's called as a Shield test. Okay. It is also FDA approved to check for colon cancer as well. It is sensitive around 85% in picking up colon cancers, but it is less sensitive in identifying those precancerous polyps,
Okay.
around
Oh,
that makes
73%. So, as I said, screening colonoscopy is the best way, but it's not the only way. So, I would encourage patients to talk to their primary care providers and their gastroenterologist and choose what they prefer. And it would be better to be screened than not.
Absolutely. And you talked about there's so many different ways to screen. What about treating cancer? So we talked about removing polyps. Are there other things?
So removing polyps will essentially prevent cancers, but if it's an early stage colon cancer where it's involving only the lining of the colon, it can be removed during colonoscopy. But if it is spread beyond the lining of the colon, generally you start with a surgery, removing that portion of the colon, and then it depends upon whether the cancer has spread to other organs. Then a cancer doctor will further talk about any chemotherapy, radiation therapy, or sometimes if there is only like one or two tumors that is involving, say, liver, they can be removed as a curative option too. So the cancer treatment is progressing at a rapid pace. The treatments are always changing. So, I mean, a colonoscopy will prevent it, but if you have colon cancer, it all boils down to like what stage the cancer is.
Wow. I didn't realize how much you really worked hand in hand with oncology. So it really does.
Yes.
Yeah.
You do
Yes.
get that little
Oncology
taste of
and
it.
also general surgeons too.
Yeah.
Good.
Oh, that's
So,
cool.
kind of stepping back for a second, we've been talking about colonoscopies and their importance, but let's kind of like break it down and talk about what exactly a colonoscopy is, like what people can expect.
that's good, yeah.
And, because I think there's a lot of fear. People are just like, oh my gosh, I don't need somebody up in my business. And but it's a lot simpler and easier, I think, than a lot of people think. I know people talk about, oh my gosh, the prep is horrible or whatever. So kind of give us a rundown of what to expect with a colonoscopy.
Yeah, I mean, I get that. I see a lot of my patients. Some of them are a little apprehensive about colonoscopy. Most of them are apprehensive around the prep that is involved with the colonoscopy. Some have some reservations about the procedure itself, and some have reservation about the anesthesia that is involved.
That makes sense.
So mainly with the prep has improved significantly in the last few years. Now there are smaller preps that are available, which are very well tolerated by the patients.
Good.
Now there are pill preps available too.
Yes.
So
I did a pill prep the last time. That was
good.
amazing.
The prep just basically cleans out your colon,
yes.
right? Okay.
So it's a very important step, because when we go in and do the procedure, a clean colon is what we need so that we can identify those polyps clearly. So prep is the most important step in a preparation for the colonoscopy. So regarding the procedure itself, it's a very safe procedure. Every year, around 15 million colonoscopies are performed here in U.S. Okay, it's
15 million colonoscopies a year.
and it should be more.
It should be more. Let's double it.
It's one of the very safe procedures. The complication rates are very low. And as I said, you will be sedated most likely for the procedure. And the sedation we generally use is propofol here under direction of anesthetist or an anesthesiologist. So you'll be asleep for the entire procedure. Some patients choose, for various reasons, don't want sedation. Sometimes it can be done unsedated as well. That's very uncommon though.
Ooh, I don't think I would want that.
So yeah, I mean, as I said, it's a very well tolerated, very safe procedure. But that being said, if you have any reservations about the prep or the procedure itself, it's better to talk to the gastroenterologist and discuss about it in detail. But for some reason, if you don't want colonoscopy, as I mentioned earlier, there are various other screening options available too that should work too.
Okay. So I know from my own personal experience that typically the prep is, whether it's the pills or a liquid or whatever, you usually alter your diet a little bit to a liquid diet with avoiding certain colors, I guess, because they can maybe stain the colon.
Yeah.
Okay.
We don't want anything like a red or purple so that it,
Yeah.
it mimics the blood. And so we want,
Surprise.
we want it to be clear. Clear. We most likely you'll be on clear liquids
Okay.
the day before the procedure. And we strongly recommend to be having low residue diet the week of the colonoscopy procedure so that it's easier the day before when you actually having the prep to be cleaned out well. So if it's done like very well, a clean colon, then if we take a good look and everything is looking good, then we don't have to repeat it for 10 years for a normal person.
And the procedure itself is fairly quick, right?
Yes. It's around like 30 minutes, 30 to 40 minutes.
And you're
depending.
asleep. Most people are asleep. You don't
Yes.
even know.
Yes.
At the very first time I had a colonoscopy, I remember them saying, okay, I want you to count backwards from 100. I think I made it to maybe 98 before I was out.
Yes.
The next thing I knew, I was in recovery, like waking up. I'm like, oh, we're done? So,
Yeah. So I mean, most of the procedure is done when you're asleep, and then by the time you wake up, you will be in the recovery. So as I said, it's some of the patients say this is the best sleep that they got.
Yes.
Especially the night before when you're drinking all the prep and are
Right,
up all
because
night.
you're up all night because of the prep. And then, that's probably what makes it.
It's like a hard
extra
reset. You press the reset button on them.
Yes, yes. And usually, so you have to have a driver take you home because of the anesthesia, of course. And so usually you go home, you sleep, you're up, you're back at work the next day.
Yeah.
I mean, it's really like, obviously there are rare cases, of course, that like, maybe it doesn't quite go that smoothly. But in general, right? It's like you were saying, it's a very safe procedure.
Very safe procedure. 99% of the time.
Yeah. So the question is, are you of age and have you had colonoscopy recently? Or your family members, right? Because I know some people in my head right now that I'm like, I got to get them and get that scheduled.
I was going to ask you how we should spread awareness, but I mean, really just talking about it, I think is...
Yes. I mean, March is a Colorectal Cancer Awareness Month. Thank you all for inviting. This is one way to create awareness. Another important way, I think, is a word of mouth. I encourage everyone who had their colon cancer screening done, talk to their loved ones about, hey, I had my screening done, it is good. And then I want them to be the ambassadors for the colon cancer screening. Yeah. That word of mouth and that personal connection and talking to your loved ones will significantly help create the awareness. I mean, recently, for example, I had a couple, a husband and wife. The husband came for the appointment mainly at the insistence of his wife. And then both of them had their colonoscopies, and husband had a big polyp that was precancerous. I removed it. And as I said, if his wife is not persistent about it, I'll say 2-3 years down the line, it would have been a cancer, Essentially, we prevented a colon cancer for him. So that's how important it is, talking to each other. Social media is another good way if you are comfortable sharing that your colon cancer screening methods, or just a simple post like, hey, I had my colon cancer screening done, it went well. I encourage everyone who needs it have it done. Will be very helpful too. And another way would be like funding or donating to organization which creates awareness. That kind of helps the organization, and also some of the organizations fund for colon cancer research as well. That significantly helps in preventing colorectal cancer.
Wow.
Great.
If you could say one thing to someone that was apprehensive about getting screened, what would you say to them?
I would, as I said, I would recommend, first thing is know what the apprehension is, what is limiting. As I said, most of them are worried about the procedure, but as I said, I get it sometimes. And as I said, if you're not willing the procedure, at least get the other screenings done. As I said, 85% of the colon cancers can be prevented if we can have a screening done. So as I said, that will prevent colon cancers.
Wow. Every time you say 85%, it blows my mind. That's amazing.
I mean, really, there's probably no other cancer that's as preventable, right? I mean, I'm not a doctor, obviously, I don't know, but
Yeah.
when I just think about it, you know, most of the time, you know, if someone has breast cancer, it's you've found it, like when it's already cancerous, and a simple 30-minute screening, right? Like, so maybe when you consider the prep and those things, like maybe you're inconvenienced for a total of 2 days total, like, right?
Yeah.
But it prevents cancer. So
that's very important.
yeah. Thank you, Dr. Gangireddy.
Yeah.
This has been
Really amazing.
informative.
Oh,
yeah.
Thank you for having me.
Yes.
So you can find Dr. Gangireddy at Piedmont HealthCare Comprehensive Digestive Care. So talk to your primary care provider about making an appointment with him if you want. And remember, tell people about your colonoscopies.
Yes.
Share it on social media.
Don't be shy.
Don't be shy. But
Know
thanks,
your family
guys.
history, right?
Yes, know your family history and get screened. Thank you, guys. Bye.
Make sure you like and subscribe.
Yeah.
The content here is for informational and educational purposes only, not for medical advice. Consult your qualified healthcare professional for specific health concerns and questions.